Hello, I'm Kathy Porras, and today I'll be demonstrating how to draw up and prepare insulin for injection. So before anything else, I'll check the physician's order in the EHR and compare it with the MAR to ensure accuracy. I always follow the 6 rights of medication administration, which are the right patient, the right drug, right dose, right time, right route, right documentation. I'll confirm calculations with another RN for safety, and after gathering my supplies, I'll enter the patient's room and I will close the door or the curtain to ensure privacy, and then I'm gonna do hand hygiene. Hello, I'm Kathy, and I'll be administering your insulin today. Can you state your name and date of birth for me? Perfect. Do you have any known allergies to medications, food, or anything else? Okay. Your doctor prescribed 2 types of insulin. First one is the regular insulin, which is the short acting that starts working quickly. And then the second one is NPH insulin, or the intermediate acting insulin that provides longer blood sugar control. And since insulin lowers your blood glucose, it's important that you eat within 30 to 60 minutes to prevent the hypoglycemia. Okay, so before administering insulin, I'll check the patient's blood glucose level, and the target range is typically 80 to 130 mg per deciliter. And the insulin is generally well tolerated, but you might experience redness, itching, or mild discomfort at the injection site. And if you notice any symptoms like sweating, dizziness, tremors, or confusion, please let me know right away, because these could be signs of hypoglycemia. Do you have any questions before I prepare your insulin? Perfect. So I'm going to perform hand hygiene again and put on some gloves. Okay, and then next I'm going to inspect the insulin vials. I'm going to verify the correct type and dose against the MAR, and then ensure that the vials are at room temperature. Check for any precipitation, clumping, or discoloration, and then check the expiration date as well. Okay, so I'm gonna gently roll both vials between my hands. And then I'm gonna disinfect the vial tops with an alcohol swab. Okay, and then I'm gonna get the insulin syringe. Okay, and then with the cap still on, I'm gonna withdraw 8 units of air into the syringe. Okay, and then I'm gonna inject it into the NPH vial, the cloudy insulin. And make sure the needle's not touching the medication. Okay, and then inject the air to the insulin, but don't withdraw insulin yet. Okay, take it out. And then now I'm going to withdraw 4 units of air into the syringe. Okay, and then I'm going to inject it to the irregular insulin. This is going to be the clear insulin. Okay, so now I'm going to invert the regular insulin, and then I'm going to withdraw 4 units. Okay, so now I'm going to remove the syringe, and then I'm going to check for air bubbles if there's any. And then tap the syringe to remove them. Okay. And now I'm going to insert the needle into the NPH vial, and then I'm going to carefully withdraw 8 units. Okay, so it's going to be a total of 12 units. Okay, and do not overdraw. Okay, so now we're going to verify the total dose, which is the 12 units, against the MAR and the EHR. Okay, and then I'm gonna make sure to label the syringe with the medication name and dose if this is prepared elsewhere. Okay, and now we will go and administer it to our patient.